Yeah, I'm Dr. George Fareed. I'm a family practice physician here in the Imperial Valley, and I've been involved in the treatment of patients that have been infected with COVID-19 since the start of the pandemic, and particularly during the surge that we've seen in the last weeks here in the Imperial Valley, becoming the epicenter for California. I have, over the period of 3 months, reviewed studies that show an efficacy of a treatment that I am an advocate of, and that's the early use of hydroxychloroquine and zinc, and one of the antibiotics, either doxycycline or azithromycin, for a 5-day treatment that results in the alleviation of the symptoms in the bad flu aspect of COVID-19 infection. There are two aspects to COVID-19 infection. One is the bad flu. If that's not treated properly, high-risk patients can go on to develop the cytokine storm or pneumonia, and that results in hospitalizations and a mortality that's significant. It's so important to treat the early stage of the infection, and we have a treatment that is effective and safe. It's in our experience here in the Imperial Valley, we've treated thousands of patients, and we've had no side effects. We've had results that are comparable to those of at least 10 other studies in the world, and particularly and many in the United States, that show a decreased morbidity or deterioration in symptoms that may occur, and decrease in mortality. In any case, it's been so important now to take action to educate the public, such that the public will know that there is an option, and a good option, to help them recover well and avoid what we see and what I see when I'm working in the hospital at Pioneers Hospital as a hospitalist, where patients are suffering with respiratory, pulmonary problems and other effects when the virus is unchecked. The whole goal of my effort now is to educate the public and our doctors around the country, in addition to locally and in our state. But it's the early treatment with a cocktail called the HCQ cocktail that consists of hydroxychloroquine, zinc, that's very important, and that's the bullet in the treatment, in that hydroxychloroquine is the gun that carries the zinc into the cell, and the zinc is what incapacitates the virus. Is that we need to present our approach to the government, to our congressmen, our assemblymen, and our federal government, in order to achieve the dissemination of this important approach. I'm trying to reach the doctors and the patients, and perhaps it's of highest importance to reach the population, to reassure them that there is a good option and that they should be asking for it.